Hi everyone, welcome to MD-VOD, your health live and on demand. I'm Dr. John Kennedy, and today we're taking a look at allergies. It's estimated that 50 million North Americans are affected by allergic conditions, reactions causing everything from sneezing to even death. The cost? $10 billion. Today we'll learn about allergies and why knowing about them is so important. As we do with every illness, we'll help you understand what allergies are, what causes them, and the most common triggers. We'll also learn who's at risk and the most common symptoms. Later, I'll be joined by expert allergist Dr. Ziegner to discuss how to make a diagnosis about effective therapies and how to treat allergies. We'll also take a look at whether insurance covers the costs. So join us as we simplify what you need to know about allergies and how they affect our health. Welcome back to MD-VOD. And to better understand any disease, it always helps to understand the anatomy. Allergies typically involve the nose and eyes, causing itchy red eyes and inflamed nasal mucosa, causing runny nose and a feeling of congestion known as allergic rhinitis. Another common allergic reaction is a rash involving the skin, our body's largest organ. One of the most common rashes from allergies is known as atopic dermatitis, or eczema, and typically occurs on the face, elbows, and knees. Here's a classic example of eczema involving the elbows. Stay tuned and learn more about allergies. Welcome back to MD-VOD on emPOWERme.tv, where we're talking about allergies. An allergy is an exaggerated reaction by our immune system, the body's defense, in response to contact with certain substances known as allergens. It's exaggerated because these substances, which are foreign to the person affected, are usually seen by the body as harmless to other people. The top 10 most common allergens are pollens, animal hair, dust mites, insect bites, mold, food, latex, medicine, perfumes, and even cockroaches. As I mentioned earlier, it's estimated that 50 million North Americans are living with allergies and their bothersome symptoms. Nasal allergies, known as allergic rhinitis, affect about 35 million Americans. 6 million are children. Asthma, which can be allergic, affects 15 million Americans, 5 million which are children. Whether at risk for allergies has a lot to do with our family. If your mother or father has allergies, for example, then you're at increased risk. In fact, if both of your parents have allergies, then you have a 60% chance of being allergic to something, though the allergy might be different. Your mother might be allergic to bee stings, and you might, for example, be allergic to pollen. But the risk of having an allergy is definitely increased. We also know that allergies can be caused by our surroundings and what we're exposed to. Some of these include smoking, pollution, infection, and animals. But if neither of your parents have allergies, then it's very unlikely that you will either. Allergy symptoms can range from mild, like a rash, itchy, watery eyes, or congestion, to moderate, like itchiness, difficulty breathing, and varying degrees of swelling that can cause difficulty swallowing and breathing. They can also include abdominal pain, cramps, vomiting, and diarrhea. And severe symptoms can include anaphylaxis, which is a rare, life-threatening reaction to an allergen that causes rapid swelling and closure of our airway that can be deadly. When we come back, I'll be joined by board-certified expert allergist Dr. Ziegner, and we'll take a look at how allergies are diagnosed, what available treatments and therapies are, and how the costs are treated by insurance providers. So don't go away. Welcome back to MD-VOD, where we're talking to expert allergist Ulrike Ziegner to talk about allergies. Dr. Ziegner, welcome. Thanks for joining us. So allergies, it's a nuisance. It causes itchy eyes. It causes difficulty breathing, and a really runny nose. What can we do to anticipate an allergy?
The first thing is you need to have a high suspicion. If you are sneezing every morning at the same time, you need to think about what is in your surrounding, in your environment that is possibly triggering those allergic reactions. If you wearing some makeup and out of a sudden you realize that your eyelids are burning, that your eyes are getting watery, then it is most likely the makeup. It is very important to try to avoid those triggers, but in order to avoid those, you need to know what they are.
So that's great advice. Start to notice your patterns to certain things, like the time of day, or soaps, or even mascara, if you're getting an itchy eye or a swollen eye or runny nose. You know, allergies, Dr. Z, I'm going to say Dr. Z because it's so hard to say Ziegner. Allergies can be caused by many things. Kids, you know, there's millions of kids that are affected by allergies. Is there anything that we can tell parents to sort of anticipate or watch out for?
Yeah, children very often have food allergies. As a matter of fact, 1 in 12 children today have food allergies, and the incidence is on the rise. And with food allergies, there are some that are very dangerous, such as nut allergies, seafood allergies. And early in childhood, like babies and toddlers, we see more milk allergy, soy allergy, egg allergy. And we have new allergies that haven't been a problem in the past, like sesame allergy, rice allergy. And in order to avoid those allergens, it's very important that you identify the allergens first. And that is actually where the allergist comes into play, to do testing to find out exactly what the patient is allergic to. Very often we don't know, and I can tell for myself, one of my twin daughters ate a macadamia nut and had a severe allergic reaction. We have EpiPens everywhere, so we are living at home allergies every day.
So even the relatives of allergists can get allergies, which tells you it can affect anybody. And on that note, when you make a diagnosis of an allergy, how does someone typically present to your office as an allergist?
Like babies often present with bloody stools. Often children present with hives. And I advise parents to have a food diary. That is difficult to do, but it is very informative. You see what the patient ate, and then within half an hour the lips start to swell, or within 2 days you develop eczema. Eczema is another form that I see in children that have food allergies. And the key is actually to avoid it. If you are able to avoid the food, then you might outgrow it. In particular, those childhood allergies, with the exception of seafood and nut allergies, you are less likely to outgrow. And I hear it quite often that patients say, well, I don't understand what you're saying. I've eaten that every day before, and out of a sudden you are telling me you're allergic to it. Basically, an allergic reaction occurs like the cells in your bodies are talking to each other. The let's say the shellfish came in contact with your body. Your body has T cells. They are educated, we don't like this shellfish. They talk to the B cells. The B cells make specific antibodies that really match the allergen, which is in our case the shellfish. They make antibodies, and they're called IgE. And we know antibodies are good. You vaccinate children, and I call them the good antibodies, the IgG antibodies.
Oh, that's a great take home. IgG, the good antibody.
And IgE, the evil antibodies, those that cause allergies. And on first exposure, this particular antibody attaches to a cell. It's called mast cell. And then nothing happens after that. But we call it the patient has been sensitized to the particular allergen. And the patient can eat it again and again. And there comes this one day, he or she hits her magic number, and then the mast cell discharges little balls, little granules, and they're filled with chemicals, and those chemicals are actually responsible for allergic reactions.
So that's the rash and the swelling and the itchy eyes and so forth, and even in some cases a swollen airway where we can stop breathing.
Right.
So the point is, and that's a great take-home message, is that you can eat something again and again and again, and what's happening inside that you might not be aware of is your body's developing an immunity to it, and you can actually have an allergy to something that you thought you weren't allergic to. That's a great point. So how do we actually make a diagnosis? Do we do a skin test? How do we actually know that we have an allergy?
That also depends on the symptoms. If somebody is sneezing, has a runny nose, has itchy eyes, and those are people that I do skin testing. I do little skin prick testing on the back, and it is fast. It takes 20 minutes, and I measure the reaction those little hives, those allergens cause, and the patient will go home with the results saying, oh yeah, I'm allergic to mesquite tree pollens, to grass pollens, and to ragweed. And so they know exactly what they're allergic to. And to take action, it would be good if the patient goes to the internet. We all go to the internet these days. Look at the
MD-VOD.
MD-VOD, exactly. We have pollen counts all over the internet. You can actually punch in the area code. Then you know which time of the day the ragweed pollen is flying.
That's great advice. Once you're diagnosed, and let's say I come to you and I say, gosh, every time I mow the lawn, I get this itchy, runny nose, and I come to you, you make the diagnosis. How would you treat me and get rid of some of my symptoms?
Initially, I would try to treat you with medications. There are antihistamines, but antihistamines only cover a part of the allergic reaction. There are many other chemicals like tryptase, like bradykinines, like leukotrienes, and for some we don't even have medications to counteract the symptoms. And if those medications, and they're costly, most of them are over the counter these days, those are antihistamines, and they might or might not do the trick. They are actually not preventing the allergic reaction from happening, they are just suppressing the symptoms. And
great point to make, and a great takeaway is that they're just suppressing the symptoms, they're not removing the allergy. And so again, it's really important to know what your triggers are and to, if you can, avoid those triggers. But these are just medications to get rid of the symptoms. It's a great point.
If you want to really suppress the allergic reaction from happening, there is the therapy out. It's called immunotherapy, normally known as allergy shots. And what we do, we use exactly those allergens the patient is allergic to. We put them in a bottle. We are diluting it out, 1 to 5, 1 to 25, and then we will inject the allergen at a very low concentration and slowly move up, sneak in, so to speak, to get into the therapeutic range. So in the therapeutic range, the patient will not have any allergy symptoms anymore.
So we've talked about the antihistamines, which get rid of some of the symptoms, the runny nose and the itchy eyes, and the immunotherapy, where we train our body to fight off these allergens. Is there any role for steroids, corticosteroids?
We use nasal sprays, like nasal corticosteroids. It will decrease the inflammation in the upper airways, in the nose, that the allergens are causing. But you have to use it every day. You cannot just use it here or there. It takes about a week to actually work.
And is there anything on the horizon? Is there any new therapies that we have out there for allergies?
There are new things in right now in investigation. They are under investigation, but nothing that will come anytime soon to help us here and today.
Do we ever get any side effects from any of these therapies, the antihistamines, the steroids, the immunotherapy?
Unfortunately, yes, we have a lot of side effects from antihistamines. They can cause dryness. They can also cause dry eyes. They can cause dry mouth. They can cause drowsiness. A lot of them cause sedation. And if you are driving under the influence of antihistamines, you're driving under the influence in certain states, so you have to be very careful.
Wow, so great take-home message. Don't drive if you're taking antihistamines for your allergies, because it can make you drowsy and you know, a little bit literally asleep at the wheel. That's great advice. What a outstanding treat to have you here to tell us all about allergy. Thank you so much, Dr. Ziegner, for joining us. That was incredible information. Everybody, I hope you're not sneezing and itching as much now after all that information. Next up on Apple a Day, we'll learn about things that you can do to prevent allergies. We're back with our Apple a Day and how you can apply simple solutions to prevent allergies. When it comes to allergies, the most important thing you can do is know your family history. Allergies can be hereditary, so if possible, ask both your parents and your siblings about their allergies. Next, and this might seem simple, but try to avoid triggers if you know them. If you're allergic to strawberries, for example, then eat pineapple or some other fruit. Simple things you can do to avoid allergies also include keeping a clean, cool house with your thermostat set between 68 and 72 degrees. And make sure there's good ventilation. Also, watch out for symptoms like a runny nose and itchy eyes. So that's our show on allergies. Make sure to go to emPOWERme.tv to catch anything you missed here on today's show, where we talked about the diagnosis, symptoms, risks, and treatment of allergies. And for additional information, go to the CDC website shown here on your screen, because the more knowledgeable you are, the healthier you will be. And don't forget to follow us on Twitter at MD-VOD, like us on Facebook, and join the conversation. I'd like to thank expert allergist Dr. Ziegner for joining me here in the studio today. I'm Dr. John Kennedy, and thank you for joining us on MD-VOD, your health live and on demand.